Good afternoon, everyone. I'm Pat Zemer. I'd like to welcome you to the Magna Wellness TV program, question and answer sessions dealing with all kinds of information about Magna and PEMF and other complementary therapies, how they might be used and how things work with regard to the Magna device and our practitioners and people who utilize the services. With me today is Dr. Alice Maybank. Dr. Maybank is a veterinarian. She practices in Connecticut and in Florida, and she does both small animal and large animals. Dr. Alice, thank you for joining us.
Oh, it's my pleasure. And
Good.
I practice in Texas.
Yeah. Did I say Texas?
Florida.
You're practicing in Texas right now.
Yes.
Okay. So basically, we'll take your questions and supply the answers. If you have a question, simply post it in your chat box to the right of your screen. Elaine Paul is with us today. Hello, Elaine.
Hi.
And she will be taking a look at the questions and helping us keep the flow moving along, and so we all stay on the same page. So how shall I approach you, Dr. Maybank? Can I say Dr. Maybank, or should I say Alice? What do you prefer?
I like Dr. Maybank.
That's perfect. So Dr. Maybank, can you tell us a little bit about how you were first exposed to PEMF, how you became familiar with it, what your questions were, and when you made the decision to involve MagnaWave PEMF with your practice?
Well, historically, I first tried PEMF in a type of horse boot to be used for distal limb injuries. It didn't work as fast, but it did work well. And but several years later, my associate had gone to a conference and came back and said, "Are we ready to get some new equipment, because I've just found something really interesting." And she says, "PEMF?" I said, "Oh yeah, I've heard about that," but obviously she was describing a whole new concept and delivery and type of equipment. And so we contacted some clinicians, some trained therapists, certified therapists, who were doing some horse shows locally, and they invited us to come and take a look at what they were doing. And we brought a few dogs, and they treated them for us, and we got treated, and we realized that this was just, you know, whole new package of how you could use PEMF and deliver it and have quick results and amazing results. And so I would say within 48 hours, we had ordered our first PEMF machine, and then just went from there.
Wow. And surely what you saw, you mentioned the boot that you used, the results were there, but they were slow. It took longer to achieve those results. How did you feel when you experienced the quickness of the result that you would receive with the high voltage PEMF device?
I was very impressed. And I'm still very impressed. Every time I use the modality, the equipment, I'm always impressed. And I use a lot of things over the years.
Do you have an area in your practice that you use it more than maybe some other indications? What indication? Let's talk small animal for a minute. In the small animal practice, what is your primary use of the device?
Well, without looking at any printouts and statistics, my impression would be that musculoskeletal is where we use it the most. Within, you know, so pain, weakness, some pain and weakness is also neurological problems, either a disc or some other inflammatory process. So we treat back pain, shoulder pains, back weakness, shoulder weakness, hips, stifles, psoas muscles, and those are with like non-specific diagnoses. In other words, people can come into our practice and schedule to see one of the certified physiotherapists, and just based on how they feel about their pets and previous veterinary issues, and come in and just ask for them to start treatment. And so we use the equipment is to find, you know, where we need to start our treatment and to put together a treatment plan, which which is very interesting because you're applying another lens on your patient rather than just looking at what somebody says you're supposed to do.
Can you describe that a little bit more, applying another lens?
Well, rather than saying, all right, we've got a disc here, so we're going to take this and we're going to apply the coils and everything to this place because we've diagnosed that we have a disc or an inflamed disc, intervertebral disc in the back. And you can do it that way. On the other hand, there can be other things or things that contributed to the stresses that caused that disc problem, which of course we're very thorough and try to find out as doctors. But the Magna Wave and the PEMF equipment, when you go through the protocols that we're taught in our certification, we'll find those for you. If you go through the protocol and you go over the whole body and find where that pulse is causing some movement and a positive reaction from your patient, and you've already uncovered more problems or things that could be contributing to the problem that the client and patient came in for. And I think I hope I'm making myself clear. It's just when we use the equipment, we are finding out so much more about the patient even as we're doing our treatments.
And that's a big area that people kind of sometimes forget, the referred pain or where the point of origination that might be affecting another part of the body.
And our patients can conceal it, or it is so complicated that not all your physical exams and things will pinpoint it, but the PEMF just finds it and treats it. If you just work through the protocol, you can do so much for your patient and find so many other areas that either caused or because of the problem that everyone's suspecting still needs to be treated. And it's probably one of the other ways that it's so effective.
What kind of results have you seen with dysplasia in the small animals?
Now, by dysplasia, you mean hip pain?
Yes, ma'am.
Okay, very good. And of course, we're also treating when a patient comes in, we will use probably mostly the double small coil over the hips in the craniolateral thigh. We'll also treat the stifles, and we'll treat the lower back along with that. And of course, if you're treating your whole patient, you are going to be doing this spinal column. We will move the coil around depending on the size of the patient, which one we'll use, and what we call the myofascial release pattern, which is much like in the modules, moving that coil around and finding where that patient best receives the pulsed electromagnetic frequency and responds to it comfortably. So if you've started out with 5 or 10 minutes of doing that, you've discovered some other places to treat as well as what is the known area of hips, and always treat the knees or the stifles along with the hips as well.
Right, and I've noticed.
Yes,
and I've noticed in some of your photographs that I've seen, you've treated rabbits and you've treated cats, various animals. What do you see different between the various animals that you're treating?
They all respond, and they all like it. That's
absolutely, that goes without saying. But we've noticed, for example, cats really, in what I've seen, are attracted to and love to get onto the coil and lay there and spend their day if they could. And I noticed there was one photograph that I've seen of you was the cat treatment, not cat, but the rabbit treatment for a specific issue, or just something that you were experimenting with?
No, that was a specific issue, but that wasn't my patient, and I didn't treat it. That's kind of like somebody else's case, that was there, which is the beauty of it. My PEMF physiotherapists have their own patients and clients as well, and Dr. Matthews will refer to them. So I remember seeing that patient come in, but don't have any inside knowledge as to what specifically that one was being treated for.
Right, and I want to go another place from that, but I want to encourage our listeners at this point and attendees, of which we have several. If you have a question, simply throw it up into the chat roll there, and we will get it answered for you. And I just wanted to, so don't be afraid to ask a particular question that you're thinking about. To the end of people bringing their pets in for you to treat them, do you have a situation at this point where people come back repeatedly and it's easy cared, where they can come in and treat the dog's hip or their back weekly or bi-weekly, whatever the animal needs it? How do you facilitate that particular action in your practice?
Well, there are two ways that animals will come to our practice. Either they first come to see a doctor for a problem that either is, we're there as a first primary care or as consultants for a complicated problem, and we will then refer to or recommend PEMF and get that animal started under our direction. The other way is people may call up and say, I've heard about PEMF through either some of our educational advertisements, so to speak, and communiques, or from other veterinarians or friends whose animals have responded, and they just say, we've seen the doctor and this is what he says it is, can we come in and just get started with PEMF? And they can do that. And they will come in, and each PEMF therapist, we have 3 outside of doctors, will do an intake and review everything and kind of recommend what can be done if the doctor has not already done it as part of their own case, and get started. And we have a lot of follow-ups because that's easy. It's
Right.
very easy to come in and get one of those appointments. You can see the same person, you can see one of the other people. We do keep some records of past treatments and how they were doing, and reports, and it's very, very well received.
So your physiotherapist actually do an intake, which I would assume would help the doctors from the standpoint of they're asking, you've designed that, so they're asking questions that will show if there's maybe other things that need to be addressed in addition to the PEMF.
Exactly, and if they seem to think that there's something they need to ask us about, they might just come over and ask us. And but I find that they are thinking wisely. They're using what they've been taught in their certification, and it's convenient, because doctors are there or can be
Right.
called.
Mm-hmm.
So yes, that's done, but probably the majority of the time they are working great therapy, completely in the communication with the owner and the history they're given, and doing their protocol and seeing how the patient tells you what they need, and treating the places that seem to be indicated, and treating all those places that the treatment, as you're treating, you begin to see where you need to put your coil or your treatment and continue going.
So how much of a role has the PEMF, MagnaWave PEMF played, and as you motivate throughout your community, or your other doctors or your practitioners motivate throughout the community, and people ask questions about what's available for us to treat our dog who may be looking for alternative methods, and I know you're a lot into the alternative medicine area, how are people receptive to this conversation? Does it open the door to conversation?
If I understand what you're saying correctly, which is how do people feel about PEMF and the avenues that they can take to get there, I think it's kind of 50-50. There's so many people who still just want to see a doctor first, and then the doctor will say, sure, we think PEMF will be good for you, based on everything else we can do. We think it's the best recommendation, or integrate it with other things. So it could be another discussion about how much we integrate PEMF with medical treatments and acupuncture treatments and chiropractic treatments. or I could answer specific questions. So some people come in that route, and other people are just so happy to have easy access to a really healthy modality, and they call up and say, I'd like to bring my dog in and see if PEMF will help them. And, they come in, they like the professional presence and expertise of the physiotherapists. They get excellent results, and they're very happy with it. And that is their access and that is their connection with our center, which is to come in and get PEMF therapy.
We have a question.
Yes.
From Steve. He said, how do you determine efficiency of treatment with animals?
Efficacy, I think, is what he means there. Efficacy of treatment.
Sorry about that.
That's okay.
Well, it's all by results, and because you can administer a medication or a modality to a human, and even though you're looking at them and you go, well, they're still walking the same way, or they still have a little bit of a cough, or whatever you're observing, they will say, yes, but I feel better. Like, they'll give you the first early indication that whatever you're doing makes them feel better. With animals, to be objective, it's entirely upon results. However, the people who love these animals and bring them to us are very insightful and tuned in and observe far more subtle changes. And they will just even report, wow, after that treatment, the strained look in its face and the size and laying down comfortably, and they will notice if it's a very painful animal or an animal of very significant signs. They'll tell us first that they believe that their animals are feeling better, their pets are feeling better. Our determination is their reports, but also we are looking for results. So, if they have hip pain and they have trouble getting up and walking, that they are getting up more frequently, that they are getting up more efficiently, that they're walking around more and engaging more, and their gait is improving. So depending on why they came in, we are looking for the results of having addressed that problem.
Very good.
I answered that. But that is the thing of veterinary medicine. It's by observation. You're never asking your patient, how do you feel?
Okay. Elaine, do we have another question?
Yes. Tina is asking, can this help a dog with a spleen issue?
A spleen issue?
Yes.
Well,
perhaps I can start, Alice, Dr. Maybank. Just from the area of circulation and improved blood oxygen would be of benefit.
Mm-hmm. Well, you see, my broad answer is, even when we get right back to the physics of how PEMF works and what it does on cells and tissue, it will improve function or even enhance function of tissue. So if you have a tissue that's diseased or dysfunctional and that's why it's causing the disease, if you treat it appropriately with PEMF, you're going to improve mitochondrial membrane function, cell membrane function, tissue function, and all those things that we talk about, increased oxygenation and circulation, those are all the fruits of improving those tissues and their functionality. And so, yes, I believe that there is an appropriate way to use PEMF to treat the tissues of the spleen. My only thing is, I guess to answer that, it would be exactly what problem in the spleen, because that may modify what else you would recommend. But my reaction is I'm sure it could, because the way it works is to improve tissue function at the mitochondrial and cell membrane level, and you do that to any tissue and you're helping it out. You're improving its function, and its loss of function may be what we see as the disease, or if there is a disease that's causing dysfunction, you're going to help that tissue back to be doing its job a whole lot quicker, resisting either infection or toxins or anything, improving immune function, all the things that we know PEMF does. So you can apply it to any tissue and help. How you apply it will depend on specifically what you're calling the problem.
Thank you, Dr. Maybank.
I have another question from Jennifer. Have you treated dogs with discoid lupus? Do you have a protocol you would recommend, if so?
You know, I guess if I would try it whole body and do a very low frequency, very soft impact. I have not, to my knowledge, done enough of the autoimmune diseases to know exactly how I would treat this one and how I would treat another one. I would start low and slow is how I would go with it. I'd have short treatments at first with low frequency or low pulse rate. Do I mean that correct? A more softer type of pulse. And see how the patient responds.
Thank you. And to see, just to clarify, the way we address frequency, a lot of times people will say, so what frequency should I set it on? It's a pulsed electromagnetic field, and the frequency is the speed of the delivery or the intenseness of the delivery is
so
how we determine frequency.
The softer one.
Correct.
So I thank you for clarifying that, because we do it intuitively. We all understand internally in my practice what we're talking about. So I want to be clear to everyone who is on this webinar, which is I would start something like that, short duration, 10 minutes, and I would use one of the faster speeds, see how the patient likes it, and do a couple of those, maybe 2 a week. And after about 4 treatments, see where we're going with it, because you're talking well, autoimmunity is very complicated. You need to support those tissues, get them back to good health, but you want to make sure that you are not letting that animal get into any kind of a healing response that would upset the owner. I would go very slow and carefully with that. If that person would want to contact me and we can stay in communication and maybe start sharing information as we see more of these cases, I'd be glad to do that. But I haven't got any personal experience in the numbers where I think I can say I know a protocol for that.
Right, but the fact that we can approach the tissue is very beneficial, and thank you. Perhaps we can set some way that we can easily have communication if somebody wants to do that. That will further the research for all of us.
Right, and what I would tell the owner is, yes, I do believe PEMF can help you. We're going to start slow, and easy, and not rush it, and that's the way I would approach it. I don't have like a specific, oh, I know what that is and this is how I'm going to treat it. I would just gently treat the tissues and watch my response, and from there you may see that you could go stronger, or you may want to do more treatments closer together or spread them out.
And the thing that we accomplished there, just so everyone understands, the protocol, I used to read the label on the aspirin bottle, and it would say if you have a headache, take 2 aspirin and rest for 30 minutes. If you have a sore throat, take 2 aspirin and rest for 30 minutes. If you have a sore back, take 2 aspirin and rest for 30 minutes. So often the protocols are very simple. The key is to pay attention to what's happening. To start low and slow is always good. And then you can increase it a little bit as you go along, but the protocol is basically the same. Keep it comfortable, do it for a period of time that you can just know that you've got something you're going to be able to read, and then watch and see what happens. The protocol is very universal from that perspective, and then you learn, as Dr. Maybank pointed out, we can go a little higher, we can go a little more often.
I have another question. Steve says, Is it more difficult to use the MagnaWave with small pets versus larger ones? Steve is uses the MagnaWave at home, would like to use the MagnaWave at home, and maybe treating his small pets and larger ones. Do you have any advice on using with both different size pets and how you treat maybe the rabbit compared to a dog?
Well, you know, any small animal, you can just place them in the middle of the large coil, and you are doing a nice treatment of the whole body, and they enjoy it. They learn about it. And for a lot of our kitty cats, that's all they will let us do. In fact, some of our kitty cats who don't want to let us know how much they like it, we will actually, if they're in a kitty cat carrier, just put that on top of the coil and treat. And we've had amazing results just doing that. In past seminars, we've talked about certain heart diseases resolving with PEMF. And we have one case, cardiology specialist diagnosed hypertrophic cardiomyopathy in a cat, for which there are we have treatments, palliative treatments, supportive treatments, but there are no cures. And this is one of the hardest cardiac diseases to treat in cats, or even to manage. And it went in for its regular follow-ups, and they found no sign of hypertrophic cardiomyopathy in this kitty cat. So amazing things can happen with as small of an approach as that, but we tend to think that they would be afraid of other coils applied to their body, and you saw the rabbit with butterfly coil around it. I have found that a lot of these kitty cats love having you do more once they've been introduced to being just sitting in the middle of the large coil, and they're receiving this to get out that butterfly and the double coil or the zoom paddle, and trying to find some specific areas. Move it along their backs and see if they really like it in some area of their back, and start moving it around using more specific and moving use of your coils and treatment sites. So they are a little harder, because if a small animal has a hurt knee, it's very hard to get what we have so far around it, and so we rely on generalized treatment. But go for it. You know, I find that they're very tolerant of being moved around and have that coil placed as best you can over an area that hurts.
If I may expound on that just a little bit, a lot of folks have a question. If we treat a horse and we turn this up a little bit on the horse, and surely to God that would be too much for a small animal. And the reality of it is, it's not necessarily too much for a small animal. The fact that you're thinking of it small, meaning it has to be a very light dosage, is not necessarily the case. You will know if you're treating a small animal. If it's too much, they will not allow you to do it. They will move away. They will be very uncomfortable. And so comfort is the key. But if you're treating a knee on a dog or a foot on a dog, you could probably turn that in many cases as high as you would treat to turn it up on a horse's foot.
You have to be very open-minded. I always make sure I'm dialed way down, whether I'm approaching a horse or a small animal, and I bring it up. And probably the levels that I use it are pretty similar. I would say the highest thing ever would be when I'm down right around the foot on a horse. You know, you've got that cranked up, and I don't think I've ever had a small animal at that slow speed. But I will just something we have all realized within Frontier Wellness Center is lots of times we think animals are moving away, but they're actually moving something towards the coil.
Right.
We've had to go, oh, that's what you want, you know, and I find that with horses too. They start moving around and they're trying to get what they want underneath, you know, your hands for treatment. So always have that open mind. Are they moving away or are they moving towards me? And be ready to give what they're indicating.
Right.
And that's true. So often we have that in horses, and we need to discuss horses a little bit. But, you know, are they walking? If they're going to walk away, you'll know they're walking away. If they're going to walk around, that's okay.
We had several more questions coming in. Tina would like to know, could or has the MagnaWave ever helped with seizures in dogs?
Well, we did on your I think it was the first seminar, webinar in this series, we heard from the manufacturer saying, strongly recommend don't treat seizures because it is, you know, you're putting yourself into a
At risk.
at risk, yeah, some type of liability, whether it's true or not. So that being said, it should be repeated. However, we've not found, you know, we want to be careful and we will continue to be careful, but we have found PEMF to help support a lot of these seizure patients. But again, I guess I don't want to expound too much because I wouldn't want to walk anybody else into risk. We have found that it is helpful. It helps tissues. So if you use it appropriately, you are going to support those tissues. They are going to function better. A lot of these animals are on medications. And I guess I would, at this point, say most medications are 1 time a day or twice a day. There are 3 and 4 times a day medications, whether it's antibiotics or seizure medications, but usually for compliance sake, most clinicians will pick something that it doesn't have to be given so often. So if it's a once-a-day treatment, we schedule people to be at, you know, if you're treating in the morning, we want to see you later in the day. If you treat twice a day, we want to see you in the middle of the day. And that is just our precaution, because if we're at that point, we're probably not going to, you know, just by absorption rates, be causing a too fast an absorption across cell membranes into tissues. So we're very careful on that about what's the medication. We get animals who have not been on that medication and use it, and they avoid medication. So I want to give the modality its due and say it has a place for seizure patients. The other side of it is it's a risky place to go.
Yes, and I think what Dr. Maybank is saying and what Michael said a few weeks ago, to make a statement, if someone says, will this work with my dog's seizures? Oh, absolutely, this is spectacular. You want to be careful there, and if you do approach a small animal with a seizure, you want to be, as Dr. Maybank points out, cautious when you're doing it around the medication and so forth.
I have another question from Steve. He said, I understand the device works on physical problems. Does it also have a place in treating immunity problems like feline AIDS?
I imagine it does, but we've not used it as such. At this point, I can't speak from experience to say, yeah, we use this and we see, you know, certain relief from symptoms or need for medication, supportive medications. To my knowledge, or at least I have not treated a patient for the diagnosis of feline AIDS. I can't respond.
So, and it's a tough one to approach. The only thing that I would think is, and I've said this before, and that is good oxygenated blood, good healthy blood flow, white blood cells can do a lot of good things. And so, as Dr. Maybank points out, it's very difficult not having treated any condition like that, but it's a very good question.
Well, my answer is, I'm sure you'll make that cat feel better. If that person wants to know if you're going to cure feline AIDS, I can't say that, and I wouldn't want to say that. It would take a lot to prove that. But do I think it would help that individual? Yes, it would, like it would help any other, because you are improving tissue function. If you're improving tissue function throughout the body, that animal's going to thrive and do better.
Excellent answer, Dr. Maybank. Thank you.
I kind of wanted to get to the horse side of your business in Texas, and kind of wanted to ask you, what has been the most surprising results that you found from using the PEMF therapy with horses? Has there been any cases that stick out in your mind as that really took you by surprise?
You know, I will just first say we have had success in reining horses that needed repeated hock injections to be able to perform as well or better, because we're treating the whole horse, probably as well as the hocks. And I've used this on sore hips in horses and backs, so the gambit. But if you're asking me what stands out in my mind is, well, I'll say knees, but it's actually the carpus, what some people will call the front knee. And it doesn't matter whether it's an older horse with a slab fracture and horrible arthritis, or a young horse with carpal deviation, a young horse with fasciitis after surgery on their carpuses or knees, if that's easier to say. I would just say front limb problems involving the knee or deviations of the limb. It's just astounded me. I would always, I've had yearling colts with the limb deviations and been able to bring those around without surgery. There was one case of a colt where there was an overcorrection after surgery and brought that right back again. And I don't mean 8 weeks of stall rest and coming in every other day. I mean the owner calling me up and saying, can this be looking better already after one treatment? Now, it's not resolved. You know, what I'm saying is I'm not telling you, and it's cured, but I am just saying beyond anyone's reasonable expectations, it has so far astounded us. And I know a few people have posted about foals with limb deformities. I would get right on those, and especially because foals grow so fast. And the important part is you have to treat above and below the joint and the whole body, because all those muscles are also interacting and out of balance and contributing to any limb deformities or deviations. But whew, that stands out in my use as extraordinary.
Excellent, excellent response. Thank you very much, Dr. Maybank. We're not out of time, certainly, but Dr. Maybank does have some appointments that she's going to need to get to promptly at the end of the program. So if you do have a question, please put it in the chat box at this point, and we will do our best to get it answered and come along with that. Speaking about foals, Dr. Maybank, we had here in Kentucky just last year at one of the larger thoroughbred farms. We had a very valuable foal that basically was up and moving around well and was playing in the paddock and flipped and hit its head on the fence. And they called me. They tried to get the local practitioners in Lexington, and they were all out and busy. And so they called me in Louisville, and they said, this is what's happened. What do you think? And I said, well, we need to treat it. And so I ran from Louisville to Lexington. I got there. The foal was just laying in the stall with its eyes rolling back in its head and very listless and very little movement, and the vet was on his way, and he was afraid they were going to have to put it down. They cleared the use of the device with the veterinarian, and so I went and treated the neck, the torso, and the right on the head of the horse where he flipped over and hit very low on the head. I treated the neck and the shoulders a little more aggressively, but again, it was a young horse, and in 15 minutes the horse's eyes were focusing and keeping and watching what was going on, attempting to raise his head just a little bit, and within 2 or 3 days, the horse was up. Still not sure on its legs, but up, and over time the other practitioners got in there and treated it regularly, and the horse recovered completely.
And probably, yes, I marvel and can think of all the pathways that benefited to get that foal rescued from what was probably a lot of tissue swelling that would have been life-threatening. And medically, I don't know that we could have fixed that any faster than what PEMF did.
Yeah, it was exciting, and I was a hero for a day. It was a lot of fun.
That's all horse owners give you.
That's right.
You're only as good as your next, your next treatment plan. So.
That's right. Till the next time they tell you they're lame.
That's right.
So coming to horses, areas, the hock is an area that a lot of people question, and how do we approach it? How do we tell it's there? How do you feel about the area of the hock?
Well, from all my experience, you know, a hock can be confirmation and overuse, or it could be secondary to some other problem. When I've gone out, when I've been called out so far, is they've already been diagnosed by other veterinarians and they've been treated and by either injections with steroids or hyaluronic acid or both, or acupuncture, which of course is a good medicine, and I do that. But I find that the hocks that I've treated have responded very well, and I spend these I spend a lot of time on. You know, they are you know, I go through, I open the horse up, I check the whole body. Sometimes before I go in, I'll do a hock flexion and see what else I might think about it. But then I use the double coil, and I go all around that hock. I go all around the leg. I usually go a pattern. I'll start proximally right up under the stifle, right up in the groin, and I go from one side to the other across the rostral edge of the leg or the cranial edge of the leg. I go back and forth, down, do a weaving pattern, back and forth, up, do that for a while, just open up all the circulation, get all those muscles comfortable, anything that's been tense or spasmed, just let it receive some treatment, and then I will, again, I use the butterfly coil or the double coil, and I'll hold it on the front side of the hock over the back side. I'll put it medial and lateral. I'll butterfly it around, and I'll give that a good 10-minute treatment, just moving that around all over. And of course, if it's both hocks, well, you're spending some time, but it's also a real practice builder, so it's worth the time. I don't know whether you know, anyone would, you know, I even try to make sure if I've just been invited in to do the PEMF that I'm not too overly involved in trying to change shoeing or anything else, but if something stands out to me, I might mention that. But I think that for a lot of these chronic horses, it is a great alternative to having repeated hock injections, at least in my experience.
Great, thank you very much.
I have one more question. Becky would like to know, what about treating cartilage damage in the stifles?
Of a horse?
Yes.
Okay.
I'm assuming because we're talking about horses and she just asked it.
Okay. Well, I treat a lot of undiagnosed stifles when I'm asked to come out and see a low back problem or a hock problem. So lots of times I'm treating a stifle no one has really asked me to come out and treat. But so I'm evaluating it with everything else I've been asked to come out and do. And I think that it is very, very helpful with stifles, just like it's very helpful with stifles in small animals. I will tell you how I treat them, and it's up to you if you can do it. I find that lots of times the stifle hurts and has a problem and may have torn up some cartilage, but what's aggravating it is the imbalance of the hamstrings and the quadriceps and the adductors and the abductors in connection with the hip. So I treat the hip, even on the horse. I'm not going to talk about the whole horse, that's understood. I will treat the hip and find areas all around the hip that may take up the pulsed field and treat them appropriately, go down the lateral leg. I will put it all around what would be the distal femur and the patella and the proximal tibia, which of course that altogether that is the stifle joint. And I will hold the double coil medially, you know, to the inside. And I'll admit you don't have a lot of space, and you got to hope you have a good horse, and you introduce them to it so that they accept it. I don't know. I tend to just go confidently, and they let me do it. But you have to use your own confidence in this. And I hold that double coil on the inside at the insert of the stifle, on the outside, over the patella. But then I'll also take that double coil and I will hold it as high up and on the inside of that thigh as I can. And you will usually find those muscles are going to move, and that horse loves it. And I treat that whole medial thigh. And then if I have the time and a nice horse, I'll get a large coil and I'll wrap it back to front around the strap muscles and treat there as well. And you also have to remember to treat behind the stifle. It's very important in acupuncture to do that. You get a lot of swelling behind the stifle and the fat pad. There's a fat pad behind that joint. And you want to make sure that you also put your coils over that to help that either rehydrate or, you know, lose some of the swelling, whatever the case needs to be for that. So I understand the point is to treat the cartilage and help it heal, but if something's continually damaging that cartilage, you're kind of not going to get so far. Not my short answer. I'm sorry.
No, that was wonderful.
Perfect answer.
I have another question. Jennifer would like to know, does the MagnaWave speed hawk fusing or relieve the associated pain?
To fuse a hawk, I'm going to use some vernacular and quick terms. When we've ever talked about fusing a hawk, you have several joints in the hawk. If they're all reactive, they hurt. So if you let them just sclerose down and they're no longer reactive, they don't hurt, and yet you still have a functional hawk. So I cannot give an experiential, answer, but my feeling would be it would not, because it would want to heal those tissues. Do you know what I mean? Like MagnaWave heals, it doesn't destroy. And when you're talking about fusing down those hawks, you're really destroying the the central joint there and the cartilage and the joint space when you're trying to fuse a hawk. But again, I am speaking off the cuff. I have no experience. What do you feel about that, Pat? I don't know.
Well, we've always approached it that by virtue of what it's doing, if they're wanting to get there, but you're exactly right. We are more of an inflammation reduction and healing promoting device as opposed to something that is going to fuse something that we want to take away some issue from. So it's
trying to break down a joint space with fusion, and that's kind of doesn't. Right. I don't see PEMF doing.
I can say that we've had people with troubled hawks, and they start talking a lot of things, and we treat them, and the end result is what they want. Now, if they actually accomplished what they were talking about, I don't know. But the end result was a good functioning hawk. Everybody was happy.
Right, which is my point. But they're asking, would it hasten fusing that joint? And I don't know. I wouldn't. I don't know that it would do that. Probably the horse would get better and like it, but radiographically, I don't know what you might look for changes and to see whether it fused the hawk or not.
So what I will do, just from the standpoint, is I'll kind of throw that out to some of our other folks who maybe have had more experience with that, and bring some answers back for the community.
They may even have radiographic evidence, because usually the decision to fuse a hawk is based on, well, I think we're better fusing this rather than trying to heal it. So someone may have even some radiographic pre and post to seal the deal on that.
To the second part of her question, it will certainly go a long way to relieve the associated pain with the issue.
Absolutely.
Allow me to ask you one more question, Dr. Maybank, because we are getting close on the time that you have available for us today. You talked about acupuncture as a complementary modality to the MagnaWave. I just will share quickly, one time in a racehorse barn in Florida, we're treating all the horses, and the trainer has us treat this horse, this horse, this horse, this horse. Then we're leaving that morning, and he says, I've got the acupuncturist coming this afternoon to check some of these horses. The acupuncturist got there, and we had opened a lot of the points that he was maybe looking for, and that became a little bit of an issue. So how have you, it wasn't a problem, but we didn't expect him to come, and so we did open some of those points. How do you use the MagnaWave along with your acupuncture in your practice?
That's kind of an uncomfortable question.
Oh, never mind. Let's just...
But I'll speak from the heart and be honest. I find I don't need to do as much acupuncture. acupuncture is an excellent modality, and if the electricity and the grid goes down, I am so glad I can heal with acupuncture and I can heal with my hands. But and I still do it. I find that sometimes I do a lot of PEMF, and I go back and do an acupuncture treatment either before, after, or instead of a PEMF, and we get some enhancement. But that, I believe that is also due to the fact that it's always nice to switch modalities. It's like rotating the tires or something. A fresh approach is always good. But I love acupuncture. It's great medicine. But
you're actually doing acupuncture with your MagnaWave as well.
Exactly. And what I'm just saying is I find that the MagnaWave is a cheaper, faster, magnificent tool. Okay. And I am affecting all those same points. So I don't think it's contraindicated. I do use it with it at certain times. It's always refreshing to change modalities a little. But I even do less chiropractic if I do the PEMF first.
And it makes the chiropractic easier in some cases because they're more limber.
Right, exactly. So makes our jobs easier.
Absolutely. Absolutely. Well, listen, we're just about out of time. Ladies and gentlemen, I want to thank you for joining us today, Dr. Maybank. It has been wonderful to have you with us, and I look forward to having another conversation to this end at another time. So, Dr. Maybank, any closing thoughts?
Just go out and do good work because you've got the tool to do it. It's just wonderful. I'm very enthusiastic about this modality. It's a game changer.
Thank you very much, Dr. Maybank. And again, ladies and gentlemen, thank you. Elaine, you did an excellent job keeping us on task, and we certainly appreciate that. So, ladies and gentlemen, next Tuesday, 1 o'clock Eastern, we'll have another guest and more questions and answers, and we'll have Dr. Maybank again soon, I'm sure. So thank you very much, everyone. Have a great day. Ride the wave. Bye-bye.